All right, all right. What's going on, everybody? How are you today? Andrew, what's happening, my man? How are you?
Good, Spike. How we doing?
Good, good. Well, we appreciate everyone that's tuning in here, whether it be LinkedIn, whether it be our YouTube live stream. I know we got a couple different channels, so want to thank Andrew for being here, and as well as our lovely moderator Tyler. So thank you for helping us out today. So if you haven't had the chance to get to know us, this will be a good chance to learn a little bit about myself, Andrew, and then ultimately what you're here for is to stop accepting your high health insurance renewals. So we get it. We understand that each year gets tougher and tougher to manage these types of claims, managing these types of things with your employees, your business, the bottom line. So the whole point for today is we hope that you get some different ways to be able to learn how to navigate this. So without further ado, we'll go ahead and kick this off. But before we do, if you have any sort of questions, please feel free to put them in the chat. Tyler will go ahead and moderate those as we continue to do this throughout the stream today. The more questions you have, the more interactive we would love it to be. So ultimately, we're doing this to try and make sure that you get what you need out of this. So without further ado, let's kick it off here. You ready, Andrew?
Sure am. Let's do it.
Cool. All right. So what are we going to be covering today? So first things first, you're probably wondering who these two good-looking guys are on your screen, right? Andrew might be a little bit better looking than myself, but what we do and who we are. My name is Spike Engelman. I am the managing partner of Sassetti Benefits. Ultimately, we created Sassetti Benefits a little over a year ago with the intent of knowing that there is a lot of gobbling up within the brokerage community where there's a little bit more of like that small fish in a big pond syndrome, and ultimately wanted to create an avenue for clients to have that specialized care that can have that one-on-one approach, but also still have the strategy and resources of a big firm, which is ultimately why we created Sassetti Benefits. So we still have the bandwidth to do some of these things that the big brokerage shops do, but ultimately still have that personalized touch. So I have been in the healthcare industry for a little over 6 years now, but have been touching it since I've been out of college here the last decade. But Andrew, would you like to give a little bit of background on yourself and your expertise in the industry?
Yeah, absolutely. Thank you, Spike. So my name's Andrew Gilson. I've been in the industry now for a little over 12 years. I know when, Spike and I, we were huddling up just to, think about something that we could present. Renewals was right off the bat what came to mind, just because of this year alone. This has been by far the worst we've ever seen it. Just when it comes to the overall increase that we've seen, average renewal increases and what they're looking like. So we're really looking forward to today. I can guarantee you every single person here is going to find something that will, pique some interest to reach out to us, to see if these are maybe some strategies that we can look to implement. So we're definitely looking forward to it and appreciate you all joining us.
Yep. And the other thing I'd like to mention, just to piggyback off that, is today we're just going high level with some of these things. So if you're interested in diving a little bit more in detail about some of the things that we're offering, there's also some aspects that we aren't even going to cover today. Please feel free to reach out. Happy to have a candid conversation and see how we can help out you and your firm. So that does it with the intros. What we're going to also cover is why these renewals are growing these double-digit numbers year over year. The strategies to help offset them, a couple of case studies to prove that we're not just making some of these things up, and then moving forward, what essentially best next steps look like. So let's do it. All right, so why are the renewals so high? This is not going to be one of the best things to start off with, but we need to help you brace with for impact here. Typically, in the years past, market trend has been anywhere from about 8 to 12% for renewals that we've seen. Unfortunately, this year, we're looking closer from a national average at 20%. So obviously, yes, that can be higher, it can be lower, but this year more than ever, these renewals are going to be higher than what we have seen in years past. And it's attributed to a couple different things. So one of them is just the rising healthcare costs in general, right? It's no shocker that life in general over the last few years has gotten a lot more expensive, whether it be your gas, groceries, whatever it may be. Healthcare costs is no different. The only difference with it is healthcare costs is usually a bit more expensive, right? So these hospitals, physicians, healthcare systems, they're continuing to increase their prices for the medical services anywhere from that 15 to 20%, which in turn is why you're partially seeing these 20% increased renewals coming down the pipeline. Part of that is also just because of the fact that a lot of the healthcare systems within Illinois, they're gobbling each other up, right? They're consolidating. There's a lot of mergers that are taking place. So like Advocate is a great example over the last few years of how they added a couple different new hospitals within their system, which is causing less competition out there, right? So second bullet point here, RX inflation. So your prescription drugs. Candidly, prescription drug costs is what we're seeing some of the highest increases year over year, the last, call it 5 years. They are exponentially growing, and part of that is because of specialty medications, biologics, new therapies. They're putting a lot of pressure onto these high cost plans. So they're attributing to some of these ongoing medications that we're going to see that continues to impact your healthcare plan year over year, month over month. And it's ultimately just going to continue to rise these renewal costs. Higher utilization of healthcare services. More people than ever are seeking medical care, elective procedures, and preventative services. A large attribute to that is the aging population, right? We have that boomer population, and not necessarily all of them are within the Medicare plans. So that is going to continue to enhance and add to those added additional values. Increase in chronic conditions such as diabetes, heart disease, obesity, mental health disorders, ongoing treatments. These are higher than ever as well. So it's an amazing how many times we look at these different plans and we're looking at some of the data, and you call it the top 5 people within their prescription drugs are on some sort of medication that we haven't seen within years past. So and the last piece, the workforce and provided shortages. We're seeing a lot of healthcare labor shortages that have led to higher wages within the hospital. Good example of that is you've probably heard of travel nursing, right? A lot of these hospitals are filling different gaps within their nursing shortages through travel nursing because they can't help with the demand that they need. So ultimately, with all these factors growing together, it's contributing to these higher healthcare costs and ultimately increasing the 20% we're seeing across the nation here. So
Spike, if you don't mind too, just something I want to add, just because it was the number one bullet point you went over, and really, in all honesty, everyone, this is kind of the main driver to it. Because of the aspect of the rising healthcare costs, it's what providers and hospital systems are spending just to get paid. Now, when I say get paid, not by the insurance companies, but actually by the end users themselves, us. So, you think for every dollar that's coming in, they're spending about 15 to 20 cents just to recuperate that dollar. So you can already imagine, what that overhead cost looks like. And I'm sure you've already kind of experienced it when you've received a bill, how quickly these providers are calling you, how quickly they're willing to negotiate, maybe lower the overall cost to get it paid because of the amount of money they're spending to get paid by us. That's a little bit of a bubble, that we would say from our opinion, from our seat of why we see that happening is a consequence of the ACA, initially with Obamacare, with that being implemented. A sense that so many people had access to coverage. Yes, it is affordable coverage for some individuals that might be getting subsidies. The problem is, though, they're still getting slapped with $7,000, $8,000, $9,000 out-of-pocket maximums. And individuals who are either living on Social Security, maybe minimum wage, getting an $8,000 bill is not affordable. So they're not going to be able to pay that bill back to that provider. So that's kind of that bubble that's building within the industry, and is just kind of creating this trickle effect. It's impacting the labor shortages because of provider systems being stressed. And so, kind of the secondary issue that hasn't really started yet, but that will start to, is going to be overall access to care. We're going to find it harder to get in to see a provider, to get in those tests, to get those surgeries done because of just the overall strain that these providers are feeling. And so there's unfortunately more to kind of come with all this, but it was just something I wanted to elaborate further on there, Spike, of just kind of what's the main driver of these insurance increases right now.
Yeah. No, thank you for that.
Yeah, of course.
Well, with that being said, then how do we offset this, Andrew? How do we help tackle this?
I had no idea. I thought that was all I was here for, was just that one. Yeah, no, let's do it and kind of talk about what we're doing here, and just how we're being strategic. And really, that's what I leave for everyone here. That's the main keyword that any broker right now has got to know how to do is you've got to be strategic. If you're just going to be going through that normal rigmarole of taking that renewal, going out to market, slapping it back in front of your face and saying, hey, here's what I found, I'd really just say good luck. That's really the easiest way I could explain it. There is never more of a time, and any time, I mean, Sassetti Benefits, we're going to be strategic, but more so right now is when you have to be strategic. And there's a number of different ways that, we're looking into doing this. And we're going to kind of highlight all of these. We're not going to go through them in detail, but we do want to follow up with just some case studies just to show you some real life situations that we were able to assist with our clients. So the first of what I would say is level funding arrangements. Sorry, I want to go back to the last one here, last slide, just so we can talk about those. The level funded arrangements, that's that first bullet point. That is, I'd say, our first stepping stone of where we're going to try to see if we can find with another carrier, maybe potentially with your current carrier, if they offer a level funded product, as one of our, first pit stops, if you will.
I think we might have lost Andrew there. Tyler, can you still hear me? How are we doing with the tech here?
I think we're good. I think we just lost Andrew. I think you're right.
Okay. So as we get ready for him to come back in here, I'll pick up the pace with where he was at. But so level funding arrangements, this is typically, like he was mentioning, one of the first stepping stones that we typically see that we do with our clients. So the very first kind of big thing that people understand is what fully insured is. Looks like we're getting Andrew back here, but ultimately, like I said, the fully insured is typically what people have their normal arrangements with. That's where you have your premium that you pay each month, and whether that means your plan runs well, the plan doesn't, the insurance carriers are going to keep whatever sort of surplus there is. So that is typically will lump you into like this big old pool of Illinois or whatever. Yep, looks like Nicole says yes. He's frozen here, but. Typically, what that means is if there is any sort of surplus, the insurance carriers are going to continue to keep that. And so what level funding means is we actually carve ourselves out of that typical pool, that big Illinois pool that assesses the premium cost that you're typically going to have. And then from there, if there's any sort of, if we're running well, then we'll actually get the surplus back. So that's one of the easiest ways we go about doing something along those lines. And then looks like I'm frozen now here too. We'll make do here in a second.
Oh, you're all good.
I'm good here? Okay. All right, cool. Sorry, my screen's freezing up here too. But yeah, we'll try and get him back in. But a lot of these carriers typically have level funding arrangements. What we will do with that is essentially just get a couple different questionnaires that we go out. And then from there, those types of questionnaires, we can get usually better rates than that of like the open market. So that's one of our first steps that we take in getting into that. So our second one is our HRAs, or health reimbursements. This is helping employers reduce their premium cost by reimbursing employees for eligible expenses. So whether that means you're going to there we go. We got our man back.
All right. I don't know if that was all of us, because my internet was good. I didn't lose any connection.
Just you.
Oh, all right. Well, wonderful. Sorry about that. I don't know what the last piece that was heard of where we were at.
Yep, I gave a high-level overview of level funding. I know my explanation probably wasn't going to be as good as yours, so if you just want to take it from the top, go for it, my man.
All good. I'll go a little bit quicker since we lost a few minutes there. So on where I was at with the level funding is where it's going to take a different approach. Is it's actually going to look at the medical underwriting of your population, of those that are enrolled. So unlike maybe a true ACA community rated product, those aren't medically underwritten. They're essentially just looking at a rating area, generating rates based on that. This is actually going to look at your risk as a group. Some of the benefits that come with that, you get monthly claims reports. So you can actually see how much money's coming in to how much money's going out. And then at the end of the year, you actually have the ability to get money back based on, how you essentially utilize the plan. And like I had mentioned, the benefit to it is that it looks and feels like a fully insured product. Your costs are fixed on a monthly basis. You never have to pay more money back to the carrier based on your claims because you have an insurance product, which is called your stop loss, that protects you above and beyond that. Another strategy that we've looked into as well, and this is whether your current plan is either fully insured and or level funded, is a health reimbursement arrangement. Health reimbursement arrangement is a very simple strategy. What we'll do is we'll look at your current plan, see if we can implement a lower cost, higher deductible, higher out-of-pocket medical plan. And then what we do is we set in an HRA, which reimburses and will essentially reimburse the employee so that the benefits will mirror kind of what do they currently have today. So if they have a $1,000 deductible, current plan, maybe we put in a $5,000 deductible plan with a $4,000 HRA. The employees get reimbursed $4,000. So their plan looks and feels like $1,000. And it's employer funded. So you as the employer would fund the HRA. So that would be your responsibility. That would be money you'd put into the HRA. But the benefit is that it's not a fixed cost in the sense that, hey, you got to pay everyone $4,000 in that scenario. It's only if people use it. So that's been a great strategy as well to help minimize those renewal increases. In addition to that, there's what's called a MERP. So think of same strategy when it comes to an HRA with a MERP. We're going to take a lower deductible plan, put in a higher deductible plan, and then offset it with a MERP. It's just where a MERP is different. Simplest way I could put it, think of an HRA on steroids. HRA is just going to reimburse deductible and out of pocket. A MERP, we could reimburse a copay. So maybe we increase a copay from 25 to 75. Well, we could reimburse $50. So to the member, it only feels like a $25 copay. So a MERP just allows you to be a lot more strategic and customizable. And one of the other benefits too is you can create multiple MERP plans off of one medical plan. Whereas an HRA, you can't. You can only design one HRA on this one specific medical plan. If you have another plan, we'd have to design an entirely different HRA based on that one. Another solution is on the gap side. Kind of follows suit as well with an HRA and a MERP. A gap, think of it as a fully insured health reimbursement arrangement. So it's the same strategy where we put in a higher deductible plan. And then what we would do is we would purchase a secondary insurance product, which is called a gap plan. So we would purchase that gap plan. It'd be a flat monthly premium for employees that would receive a benefit. The difference, though, is that the gap actually pays the provider directly. So rather than the member having to pay and then wait to be reimbursed from the HRA or the MERP, the gap actually pays the provider directly so that the member doesn't feel that impact or at least that difference in it. We're still, like I said, using the same strategy. Just kind of think of it as a different funding arrangement. This is a fully insured. The employer doesn't have to fund anything towards that health reimbursement arrangement. They don't have to fund anything towards that medical expense reimbursement. This is just a flat monthly premium. And then that gap carrier pays those providers directly as well. Another few that we've been doing as well when it comes to funding strategies, really where I look at that is just kind of getting a lot more strategic when we're leveraging groups that are level funded. Because we're getting those monthly claims reports, we're able to actually kind of get a little bit of a story as to what's going on within your organization. And what that just allows us to do is to be able to sit down and strategically plan with you even before your renewal has come out, and to kind of give you either what I'd say like a green light, yellow light, or red light. And, green light meaning, hey, things are looking good. Yellow light, okay. Red light, prepare yourself. But what it allows us to do is to be able to sit down and strategically talk about why your renewal increase is the way that it is. So even when we do have to deliver bad news, We can explain as to the why behind it, and maybe some things that we can implement, maybe some things we can educate to your employees. Education is key right now for employees to understand their medical plan, the resources that are available, whether that's just resources for weight loss management, diabetes, or even just how to utilize your plan in the best way possible that could hopefully in turn minimize their out-of-pocket expenses, which in turn could minimize claims against your medical plan. And that really kind of, like I said, ties it into the employee engagement. It's key to be engaging with your employees at a minimum 2 times a year. I know you're probably used to just seeing your broker once a year, maybe you have some few calls here and there, but it's really important to be engaging with your employees a couple times a year. Obviously, once at the open enrollment time, but at a minimum, we have to have one other time, even if there could be once a quarter or once every so often, just to re-engage with members, to remind them of the resources that are available to them. It's extremely important because there's a lot of data that's being tossed at employees, and for them just to try and remember everything all at once, forget it. It's not going to happen. So what I'd like to do is let's actually walk you through some real life case studies. So all of the data that you'll be seeing here are real life numbers, real life current plans to their renewals, and some of the strategies that we've implemented to help offset these high renewal costs. So we'll go ahead and we'll jump into case study 1. And case study 1 is going to be using our gap strategy. So I know it was one of the ones that we talked about. So we'll be able to see this a little bit more in depth. And to kind of give you that recap of what gap does is that helps cover the higher out-of-pocket medical expenses that we're going to implement, because we take that lower deductible plan, we're going to input a higher deductible plan, and then purchase that gap product to cover that out-of-pocket expense. And the whole idea, the approach of this is because we're putting in a lower or a higher deductible, higher out-of-pocket plan, that equals lower insurance premiums. So the idea is that with the lower health insurance premiums and even the additional gap insurance premiums, we're going to keep that lower than what the overall renewal increase would look like. So the case study in itself, this was a group that was a Blue Cross Blue Shield renewal. So if you want to jump to the next slide there. The Blue Cross Blue Shield renewal, it should be looking at on these columns. There's going to be 3 different columns. You'll see your current, renewal, and then the actual rates of that gap plan. So I'm just going to wait so that slide comes up here. Tyler, if you want to go ahead and jump to the next one there. Thank you. So you'll see 3 different columns. That column all the way to the far left, that is the group's current premium with Blue Cross Blue Shield. And then you'll see in the middle column there, that is their renewal that they received on this. Now, and I know the print might be a little small, so I'll give you some numbers just in case. Like Spike had mentioned, yeah, average renewal increase has been about 20%, but that's an average. There's groups that are seeing obviously lower increases. There's groups that are seeing higher increases. This group in particular was seeing about a 13.5% renewal increase. Any other given year, we would say, hey, that's an okay renewal. This year, this is a phenomenal renewal, which is sad to say, because at the end of the day, it's still a $61,000 increase in premium costs. So we never like to say, hey guys, great news, 13.5%, because sure, to Spike and I, 13.5% based on the industry average might look great, but to you as an organization, $61,000 is $61,000. I mean, that's a potential new hire, for an account manager that you might be, needing to do that year, that now it's going to get cut from your budget. So what we did was we implemented a gap strategy. Now we didn't do it on all plans. So when you look at that far right column, that's our alternate. And this was what we recommended and what the group ended up implementing. So we were able to maintain 3 of their medical plans in place. So we always want to try to minimize disruption to employees. We don't want to just go ahead and rip everything out and put everything back in. So what we did was we were able to maintain 3 of the medical plans at the renewal, but 2 of the medical plans there that are highlighted in dark blue, that's where the majority of their enrollment was. So we knew that's where our premium savings were. And so what we did was we took those two medical plans and we implemented a gap plan on each of those. Essentially between the two, what those looked like, the gap reimbursement ranged anywhere from about $2,500 to about $4,500 of what employees were going to be receiving as a gap reimbursement. But to simply put it down to the numbers, we were able to mitigate that renewal increase from 13.5% to under 5%. And the huge takeaway on this is that the disruption to employees was minimal because of the fact that we were able to mitigate almost 10% of renewal increase and maintain the benefits to employees. And actually, in some scenarios, employees were actually receiving a richer benefit. Their out-of-pocket maximums were actually going down a hair on these. That is a win-win for a group. Anytime you're mitigating renewal increase, the simple strategy that a lot of brokers work out there is they just increase deductible and increase out-of-pocket maximums. Okay, great, but that's disruptive to employees. So we were able to save $40,000 from that renewal increase and maintain those similar benefits to employees. Another case study that we're going to go over is one of the points we talked about, which is that level funding strategy, which is definitely something that we want to make sure we can take a look at, but not all groups are going to qualify for it because once you said it's going to look at your medical risk as a company. And if your risk just isn't good enough, it's just not going to be a viable solution. You're better off being on a fully insured product with having that community rates because of the fact that your claims are too high. So the premium isn't going to make sense. And like we had said, that's a self-funded health plan. But with level funding, what it does is it inputs components that make it feel like a fully insured product. The way it feels like a fully insured product is your costs are fixed every single month, just like your current fully insured plan. You'll have your flat monthly premium. And then what happens is there's three basic components of that. You have your claims funding, you have your stop loss, and then basically just your admin costs to run the plan. Your claims, that's your self-insured aspect. That's the portion of your premium that's actually being set aside to pay for claims. And then you have your stop loss, which is your insurance aspect of your product. And that's what protects you above and beyond that claims funding aspect. So on this level funded case study, this was a group that was fully insured with Blue Cross Blue Shield. And what we did was we took them out to market to two different level funded carriers. Here in Illinois, United Healthcare and Aetna are the two prominent level funded carriers. Blue Cross does have their own level funded product. They're just still kind of, I'd say, getting their legs, if you will, to be able to stand up on. We would expect to see probably in the next 18 months or so from them having a potential, viable solution. But right now, UHC level funded and Aetna AFA have been our two primary carriers for that. So Tyler, if you want to go to the rate comparison that we ran for this group, which, like I said, was a Blue Cross Blue Shield group. They were age banded, so that's why you might see premiums look a little bit differently, just because you can have your rates broken down differently of it. But overall, this group was seeing a 16% increase on their medical plan. It was about a $20,000 annualized increase. And the two carriers that we took them out to, which, like we said, UHC and Aetna, we saw a 24.5% undercurrent with United Healthcare, and then a 4% undercurrent with Aetna. So obviously UHC was the prime winner in this case. And one of the huge benefits as well on this is that they actually saw an increase in benefits, not just in regards to the network, but also in regards to their deductibles and their out-of-pocket maximum. So we were able to move them to a carrier. We were able to save them $31,000 of premium savings to their current. So add in renewal, over $50,000 of annualized premium that we saved moving them to United Healthcare, and offered a richer level of benefit to the employees. One of the other things I want to point out, this was an 8-life group. There was only 8 employees enrolled on this, and we saved over $50,000 of premium. You can do the math. That is astronomical when it comes to what this group is paying. And essentially what UHC was telling the group is you're overpaying for your insurance. you are the healthy population in the Blue Cross Blue Shield plan that's offsetting the unhealthy population. So this group, 100% level funding was a phenomenal approach. And we're really excited to see how this group performs, just because this was pretty recent, last couple months. So it'll be exciting to see how this group performs over the next 12 months, just because 24%, not that that's unheard of. Average is usually about 15, though, is what we see groups saving, moving to level funding. So 24, that's phenomenal. So it'll be really exciting to see how this group performs over the next 12 months and see their renewal next year. And then lastly here on our last case study, we wanted to show an HRA strategy because this kind of can encompass multiple, the HRA and the MERP as well, since it's a very similar strategy. It's just the idea of, like I said, MERP can be a little bit more strategic. It's an HRA on steroids. As that reminder that HRA is taking that same strategy as the GAP. It's just an HRA is employer funded. So whatever it is that we're offsetting on that deductible or out of pocket, the employer is going to be funding that. But same things, we'll run analysis to essentially see, based on the premium savings on the higher deductible plan, what we'd anticipate as the utilization on the HRA to ensure that, hey, yes, this is going to be a strategic approach. Now, obviously on an HRA, savings are not guaranteed, and we'll show you that in the case study because of the fact that it's employer funded. So what we present, savings could be higher, savings could be lower. Just depends on the overall utilization. But we work with a phenomenal vendor who actually kind of taps us into their overall utilization. When I say taps us in, they're basically just telling us, hey, on our book of business, the average utilization is X%. They're not showing us claims reports or anything, but it really helps us to be strategic so that we can show something to you and be confident that it's going to be a good strategy to go with. And additionally, with that HRA, where it's different from the GAP is the GAP reimburses or pays the providers directly. An HRA, the wording's right in there, reimbursement. So employees, though, yes, will have the higher deductible, they will have to pay that expense. And then what they do is they submit the claim to their HRA vendor, and then the HRA vendor will pay them back. So either through direct deposit or a check in the mail. There are some situations based on the carrier or vendor that we can set up automatic claims feeds, which makes it a lot simpler, but not every carrier nor vendor can do that. But that is one of the other differences on that HRA is, yes, members will feel some difference in impact, but overall at the end of the day, we're making them whole. So on this case study, this was actually a group that was level funded. So like I said, HRA doesn't have to always apply to a fully insured plan. We can actually look at a level funded plan. So Tyler, if you want to go to the case study, you could be level funded with a current carrier. And we could also look at doing an HRA strategy. So this was a group that was looking at a pretty hefty renewal increase on their level funded plan. Their claims were just high. So although, yeah, we had to sit down and have a difficult conversation, we were actually able to sit down with the business owner and explain, but here's why. Here's the reason why we saw this increase, based on the claims and numbers that came in. So even though, yes, it's a hard pill to swallow, at least we could all kind of agree that, all right, it's justified. We understand why the carrier was passing this on. So what we did on this plan was that the group had a $5,000 deductible medical plan in place with a $7,000 out-of-pocket maximum. And what we did was we put in a $8,550 deductible plan. And so to the member, their deductible is going to stay the same at $5,000. The out-of-pocket maximum, it was going to see an increase. It would go from $7,000 to $9,000. But once again, we've got to mitigate where we can and as best as we can. But the huge benefit to this was that implementing this HRA strategy, when you're looking in that kind of middle section there on the rates, we brought that rate from $981.64 down to $763.88 on a single only rate. And then what you see in the premium differential, so under premium summary, you'll see there was about a $51,000 difference in premium. That was the decrease in the premium dollars that we saved. What we'll then do is we'll calculate in what we would estimate as overall utilization. So like I said, we've got a preferred vendor that kind of taps us in and will, give us a little idea as to what their average utilization has been running. Their average utilization, and that's pretty standard across the board, has been about 20%. So that's what we're showing then at the bottom there in those numbers. We're going to show you a savings at a 30% utilization, a 20% utilization, and a 10% utilization. So the premium savings overall could range anywhere based on that utilization from only $32,000 of premium savings upwards to $45,000, because we know we're going to have some utilization on the plan. It's inevitable. But nevertheless, this is just a phenomenal case study to show you as to, what we've been doing to help these groups manage their overall renewal increases. It is not a time to be complacent. It's a time to be strategic. We always understand moving carriers can be disruptive. We totally get it. But at the end of the day, when your carrier's trying to hand you a 20-25% renewal increase, you have disruption slapping you right in the face. So whether you're moving a carrier or renewing and eating that renewal increase, you are passing disruption on to employees, unless you, the employer, are eating that entire renewal increase, which, hey, phenomenal if you're able to, but that's also not going to be sustainable to do year over year. We're really excited that, like I said, all of you were able to attend today. We did want to leave some time in case there were any questions that came within the chat, as we would love to answer any of those questions that any of you might have. We're obviously more than happy to, schedule some meetings hereafter. So Spike, I'll go ahead and tee it back on over to you, and we'll see if we have any other questions that come on in here.
Yeah. Thank you for going through that, Andrew, and I appreciate everyone helping deal with the technical issues. This is our first time using this platform as well, so we're learning some of the hiccups from Sassetti as a whole. So I know we do have some questions that are teed up here, but before we do, we'd love to also hear from y'all in terms of if you could just put in the chat what the name of your name and your business name. We would love to hear from that, because I know we have some of the people that have just kind of like AOL type usernames in there. So we'd love to get a pulse on essentially who's attending and how we might be able to help out in the future. So if you could put in the chat any questions you may have, and then as well as just your name and company, that'd be great. So the next, basically, call it 7 minutes, we're open to help any sort of questions or concerns, anything that you would like us to go through, or anything else that you'd like to sort of reemphasize. And then Tyler, I know when you have a chance here, I know there's a couple of questions that were already asked. If you wanted to go ahead and put those up on the screen here, we can discuss those too. What are you seeing as the number one carrier that groups are moving to? This is a good one here, so I'll let you take this one here.
Yeah, absolutely. Since in Illinois specifically, since that's where Spike and I are based, Blue Cross Blue Shield owns about 86% of the market share, between the small group market and the middle market. We know that the majority of groups, when we're going out and meeting with new groups, the odds are that they're going to be with Blue Cross Blue Shield. So the number one carrier that we're seeing has actually been United Healthcare. Their level funded product has been the main driver in that. It's kind of, I'd say, a few factors that drive that. One, they've been selling their level funded product for a long time now. So they've really been able to kind of hone in their product, hone in their pricing. They do a phenomenal job at the retention. I still think they sat after this year close to about an 86% retention, which is phenomenal. The other reason too is that they've had some introduction of some new products. Their Surest product has been one of them. It's actually something, Spike, now that I think about it, that in itself could be a webinar, for us to run a live stream on. That's been great. It's been around for a little over a year now. It's essentially a $0 deductible PPO plan, menu-based option. Employees know 100% what the costs of their services are. No more explanation of benefits and co-insurance, to be able to actually go out and present to employees, and for people to be like, wow, I actually understand this. It's a different feeling. When Spike and I leave there, we're like, man, everyone actually seemed to understand what we were talking about. And it just kind of it's been giving us a breath of fresh air, and to actually hear clients call back, to say how amazing the product has been. So I'd say really those two main factors have been it. I mean, obviously their pricing has been great, and United Healthcare. Aetna, I would say it has not been far behind them. I just know they were taking a little bit of a seat back after the last couple of years, and they've been getting a little bit more aggressive into the market. So talk to me in 12 months. I might have an entirely different story for you, but that's what I'd say for right now, UHC.
Jillian, with joining late here, if you want to go ahead, I will have the information posted here shortly. Tyler will put my email up there. We can send that link to you as well. So like the YouTube recording link. So we'll be able to have that up there. My contact information is on the screen there for anybody that is looking to see this webinar, see like any of the strategies that we've gone through. Please reach out to me. Happy to send the link that way. Or as well as if there's any of these other gap plans, HRAs, level funding, whatever it may be, if you want to hear more about it, Andrew and I are open to have one-on-one conversations to see if it fits your needs and your company's needs as well. So Ashley, we got, what are the reasons for groups that are on the lower renewal increase spectrum?
Yeah, it's a great question. So you caught on to when we were talking about the averages, so obviously there's groups on the higher end and lower end. So, I'd say for groups that are seeing those lower renewal increases, I mean, are we seeing single digit renewal increases? Yeah, we are. I'd say the number one reason is they're level funded, so they're with a level funded carrier, and they're running as underwriters had expected, so when they look at your claims or your risk as a group, they basically kind of estimate what they would see on an annualized basis in claims. And so for those groups, they're essentially running on what we call a surplus. So, these groups are definitely seeing premium back at the end of the year. Average surplus, that's the money that's going back to the group, has been about $7,500. So that's what their group's just receiving back as basically a credit on their invoice. So I'd say that'd be the first component, groups that are just running well. And, it's really important to know because, those are groups that we moved from a fully insured product, majority, yes, from Blue Cross. That moved to level funding. And, here they are looking at groups getting hit with 17, 18, 19% renewal increases. And here they are getting a 7.5 and money back. So just to be able to, recap, and it's something that Spike and I like to do to say, hey, this is what your rates would have looked like if you were still with Blue Cross. So not only the money that you saved from the last 12 months, but also think about all the money that you would have saved for the next 12 months because of the fact that this would have been your renewal increase this year. Another component I would say is clients that we have with high HMO populations. HMO renewal increases have still been sitting in that low single digit area. So, we've had some groups that have implemented that as a strategy where they just try to drive more HMO enrollment. Easier said than done. It's not really a strategy we highly recommend, just because going from a PPO plan to an HMO is going to be pretty disruptive to employees. But, current clients that we have that are already with an HMO, maybe high population in it, are seeing some lower renewal increases. So if that is something that you've been seeing, that's most likely the reason why, you've got a high HMO population. So.
And I believe we had one more question left here. How is the monthly claims reports can be beneficial to us?
I know we already kind of talked briefly about it. If you were to ask me, the number one reason why is it tells us a story. And that's what I like about it the most is that, Spike and I, we can sit down with you, 3 to 4 months before your renewal is out and actually be able to tell you a rough idea of where your renewal increase could be coming in at. So, that right there is exponentially a benefit to any company and any CFO, that's running that company, to already have a heads up, because other than that, you're just sitting there twiddling your thumbs, waiting for that renewal increase. And to be able to buy you that extra 45 days, to already start to plan and how that could impact for budgeting for the next 12 months. That's going to be the number one. It allows us to sit down and look at the rough numbers of just what's going in, what's going out, and where are you positioned? That red light or green light, yellow light, red light. How are we looking? The second aspect is it allows us to be strategic as to how we can engage with your employees. Like we said, we want to engage with your employees on a consistent basis. And we can look at that report and it can already start to kind of give us an idea of maybe something we need to re-engage employees with. So for example, we just had a client probably about 3 months ago, and their utilization was up. And what we saw was a high emergency room utilization. And the report will actually tell us how many of those were steerable to maybe, let's say, an urgent care facility or just a normal primary care physician. So for Spike and I, it told us, hey, I think we need to re-engage with employees because they're using the ER way too much. Not that we don't want people to not go to the ER if they're having an emergency, but based on the report telling us that the majority of these were steerable to somewhere else, that could help significantly when it comes to the claims. And other things like brand drug utilization. Maybe we see a lot of brand name drug utilization where there's generic equivalents. Hey, that might just trigger Spike and I'd be like, hey, why don't we, push out a quick little virtual meeting with the employees, remind them about their prescription drugs, their mail order benefit that's available to them, ask their doctor about the generic equivalencies, because these are, once again, things that are going to help save your employees money and in turn save you as the employer money. So that's really what I'd say is a long answer. Short, it tells us a story to be strategic. It is the key word for this year. You have to be strategic as a broker in this industry right now. And it's one thing that Spike and I are doing probably on a weekly basis. It's just, how can we be even more strategic in this industry and help our clients? So.
Yeah, that's exactly it. And strategic and being proactive is really the two common themes here. As we get ready to gear up here, as renewal season's right here around the corner, the proactive conversations will help you get out ahead and really help to brace for impact for these high renewals that we're seeing across the board nationally. So if you have any sort of questions or would like to set up any sort of meetings with myself or Andrew, we would love to be able to do that with you. Like I said, we can make this a little bit more personalized. We can look at your data, be able to get a little bit more into the weeds, get our hands dirty on how we can actually combat these high renewals. But thank you guys again for attending. Tyler, thank you for helping us with the moderation here. My information is right there below at the Engelman@Sassetti.com. If you have any sort of direct questions or you would like to set something up, or if you just want to see this link again because of how great of a job that Andrew and myself have done throughout this presentation. So thank you all for coming. Again, we are here if you need us. And